You see this photograph? I think there is nobody in this hall who must not have had a relative or somebody he knows who has not suffered from obesity. The problem of being overweight. Either some of your relatives would have suffered it or you yourself would have. And the problem with obesity is that there is just not the weight of the body, there is also that weight of the shame. But guess, this is the surprise. I never wanted to treat obesity in my life. Never. In fact, all I wanted to be is to become the world's biggest cardiac surgeon. I wanted to transplant hearts. And this happens during your MBBS days when you're about to become a doctor. You would always want to do something what you see film stars in the movies doing when they act like doctors. I studied very hard and at that time got rank 1 at All India Institute of Medical Sciences, New Delhi, to get an MCH course entry into the cardiac surgery program. But guess what happened? 6 months into my residency, I realized that this is not the aim of my life. I could not fathom cardiac surgery being something I would be doing for the rest of my life, and I quit. Maybe I could not take the pressure. I jumped in back to Indore, to this institute here, beautiful sprawling campus, which was owned by my father. I joined the institute as the vice chair. I had everything, a big room, lot of staff to work and assist me, a name. But suddenly I realized that this is a spotlight which was not my own. I was living in the shadows of my father. And guess what? I again quit. Guys, this was the first reframe of my life. And I introduced myself. I'm Mohit Bhandari, Bariatric and Metabolic Surgeon, which means weight loss surgery. And let me tell you, I'm humbled to say that I have done the largest series of weight loss surgeries in this entire continent. This is my story. I went to IRCAD, this institute you see, and I said, I want to be a colorectal surgeon. I want to be a cancer surgeon. And they said, foreigners are not allowed in cancer surgeries in France. You have language problems. I met this gentleman here, Professor Phoebe, and I used to read about him in the textbook of surgeries that he invented the Phoebe pouch operation for morbidly obese patient. And that Phoebe pouch operation, and when you see the guy who made the Phoebe pouch operation, Dr. Phoebe, standing in front of you, he saw that despair on my face to not get into a cancer surgery fellowship. And he said to me one sentence which still remains with me until now. If you do a cancer surgery, at best what you can do is prolong some years of a patient's life. But if you do a weight loss surgery, what you do as a surgeon is that you show that light at the end of a dark tunnel to that patient. It changes everything in the patient's life, everything. And that inspired me to be a weight loss surgeon. I came into Indore and I told my dad, I want to take a loan as huge as I can, and I want to build up the first obesity hospital, first specialty-based obesity hospital of the country. And I made this. But challenges were waiting for me. At that point in time, in the year 2010, none of the anesthetists were capable enough to induce a patient as huge as this. None of them. The technicians could not take IV lines on these patients because what happens in the obese patients, you don't get the veins. The veins are hidden into the fat. There were no bed shifters available to us. We struggled a lot. We had tremors in our hands while operating. Nobody was ready to induce these patients. But that simple smile on the face of these patients when we operated upon them and that lifestyle change they had after this surgery inspired us to move into the most difficult field of surgery, that is bariatric surgery and weight loss surgery. These are transformations, and I'm not a big fan of before-after photographs, but I always show these photographs when I take a lecture, because these are not just transformations. Every photograph has a story, and these stories are very different stories, because the policeman who has lost weight will not say that I lost a lot of weight, but he said one, that I was not able to run after a thief. And all the goons would tell me, how would you run after me? And somebody who has never sit crossed leg were able to sit crossed leg. These are the stories which kept us going, going and going. And every day we had innumerable number of these stories coming to our operating room, to our outpatient clinic, to our multidisciplinary team meetings. And it kept us going. I'm not showing this to prove to you that I have done world records. My name is in Limca book, the World Book, even in the Guinness Book. But the problem here is not about these numbers. Doing the maximum number of weight loss surgeries in Asia Pacific region, doing the maximum number of surgeries in a day, doing maximum number of surgeries in a month, these are not just records. This signifies that a doctor from a small city, and why I would call it a small, because I would always compare them with Mumbai, Hyderabad, Delhi, can also get patients from all parts of the country. Patients traveling, do we not have good doctors here in Indore? And he said, no, they're probably more experienced. I said, what is experience? He said, those doctors have more glamour, they have more name, they have more trust. That day I realized that I'm going to do a reframe. I'm going to change the story. I'm going to bring all the patients from all parts of the world to Indore. And today it is happening. Since last 10 years, patients from every nook and corner of this country come to Indore to get a weight loss surgery. You can go on a train, go on a plane, every flight which comes to Indore, you will find a morbidly obese patient who is coming to Indore to get a bariatric surgery, metabolic surgery, weight loss surgery done. So this is not about records. This is not about records. This is actually about that reframe which says that surgeon from a small city can also create records, can also bring patients, and can also cause them to detour and make Indore the final destination. This is something interesting. I never thought in the wildest of my dreams that I'm going to get a license to operate in any other country apart from India. We had to write exams to get a Spanish license, to get a German license, to get a French license, to get a license in Brazil. Believe me, it's the toughest. Guys, I'm the only surgeon from this country who could get licenses to operate in all these countries, not only in live workshops, but also some of these countries even commercially. Why that happened? Because they saw that what I'm doing, I believe in that. There are a lot of doctors who would give different treatments to their patients and different to their own kins. It's not like that. The patients, they look into your eyes and they see if you really believe in what you're doing, the success start to come. And this is what has happened. These licenses have gone beyond boundaries so that my skill, my care, my affection, and my knowledge can be transferred to different countries and patients of different ethnicities. Robotic surgery. That was a time, 2012, this photograph, this was probably the third or the fourth robotic system of the country. The robots in that year was installed only in a couple of corporates. I would say probably in Delhi only, or one of them in Mumbai. I told that I want weight loss surgery to be done by robots. And they say it's not possible. Such a huge patient. See this patient. You cannot put a 200 kilos on the robot. I said, I'm going to do it. And I performed the first robotic duodenal switch on a 400 kilo patient successfully and discharged him. During those days, robotic surgery was unheard of on such huge patients. And we said that the robotic arms are strong enough to lift the abdomen of a morbidly obese patient, therefore creating space inside the abdomen, and we can do all these surgeries. I was comfortably sitting on the console and world was seeing me operate these patients. This is anastomosis, a joint between the stomach and the small bowel, which is very difficult to make. And when you are operating upon such huge patients, you will have so much of torque on your hands that you can even damage instruments, have neuropraxia, nerve injuries on your hands. But the robotic arms, they are strong. And it makes sense. We do weight loss surgeries by using the robotic. Soon the time came when people started to ask that why scars for weight loss surgery? Why can't you give a scarless procedure? Why can't we put a scope inside the mouth of the patient, go into the stomach and close the stomach by sutures and cause weight loss? This man here is Professor Manuel Galvao Neto. He was traveling all across the world telling the world, guys, you don't need a surgery. You can put that scope inside the mouth of the patient, just like an endoscopy. I think some of your relatives would have undergone an endoscopy for a gastric ulcer, which a gastroenterologist would do. Why not use the same scope to take sutures inside the stomach, no cutting, no burning, and we can reduce the stomach or shrink the stomach so that the patient eat less. I brought India's first endoscopic sleeve gastroplasty by taking the CDSCO approval, doing those clinical trials, and bringing it for the Indian patients. In 2016, when we did the first endoscopic sleeve gastroplasty, the gastroenterologists were amazed. They said, we have been doing endoscopies for last 50 years now. Never realized that the same endoscope can use to suture inside the stomach of the patient. We moved on. And then came the COVID. What happened in COVID? All of us were imprisoned inside a small room. We were all isolated. Those of us who had COVID could not meet others. And I was at my home in isolation with my wife, and I said, why can't we have a procedure where patient even does not require to come to the hospital? Why can't we have a procedure where there is no endoscopy? Endoscopy means putting a scope inside the mouth, where there is no surgery, no cutting, there is no anesthesia, and we can still treat a patient on an outpatient clinic basis. There when we came up with the idea of a swallowable capsule. And guys, a swallowable capsule is just as this small. This small capsule I swallow, it goes inside my stomach, and through this thin catheter I fill water inside this capsule and convert it into a balloon, just as this. You can see the balloon. I went to US, talked to the Indian gastroenterologist who was of an Indian origin. I said, you owe this to your country, let me get this. And in COVID, we treated patients who were obese. And when the next wave came, these were the patients who could successfully come out of the ventilator because they lost some weight. I know everybody in this hall must have heard about Bollywood weight loss stories. I'm not going to take names here, but everybody, he has gone so slim. What has he done? This guy who is with me is Professor David Cummings. He is the one who actually brought these drugs into picture. How these drugs came in, it's very interesting. I still remember that talk with him when he said, Mohit, you do these surgeries. You know the weight loss surgeries where you cut the stomach and bypass the intestine? You know why these surgeries work? I said, Prof, because we reduce the stomach. No, Mohit. There is a hormone called as GLP-1 which peaks in the blood. Mohit, what if we extract that hormone from your body or from any patient who has done this surgery for weight loss and we produce it synthetically outside? I said, is there a precedent? He said, yes. There is a lizard in the deserts of America known as the Zilla monster, whose saliva I'm researching these days is used to produce this GLP-1 hormone. And that GLP-1 which is produced in the human body after you do a weight loss surgery resembles that salivary GLP-1. And yes, we can produce it. And we can produce it outside the human body. And that's how the Ozempic and Mounjaro were produced. They came to India, and that molecule was called as semaglutide. We did the first clinical trials here in India to bring this molecule. Indore was responsible for conducting those initial clinical trials on the patients for bringing these drugs to India. We always thought that a surgeon cannot cross geographies. And if at all he has to, he can go there and operate. When I got licenses in 16 countries, I had to travel to those places. But a couple of months back, we did the world's first tele-robotic surgery. We proved to the world that now surgeon cannot travel from, if the surgeon cannot travel from one part of the world to the other, he can still sit at his hospital and operate a patient across. We went a step ahead. We also did this in a bus. The surgeon can operate the patients on the go. This is me coming inside the bus, and the robotic console is inside the bus. And you can sit and operate from inside the bus parked anywhere to any patient in the world. This is, guys, what is called as telesurgery. It has broken boundaries. It has changed everything we thought about surgery. The good thing is all this came from Indore. All these research, all these trials, all these new innovations, they came from Indore. So last but not the least, the Indian data is always questioned. I always hear that people question the Indian data, the Indian research. They always trash it. I decided for the first time that all the data I will have for my weight loss surgery patients will be put up in a non-controversial third-party database. Indore was the first city in the world, ladies and gentlemen, to have helped an American company to get a US FDA approval for one of the most pivotal devices in the history of surgical sciences. It's the magnets. You join the stomach and the small bowel, and we have been using the sutures. You heard? Surgeon would suture. You just put a magnet in the stomach, just put a magnet in the small intestine and join the two magnets, and the anastomosis is done. I think several of these examples are examples of what we are talking about here at TEDx, the reframe. I would end by saying that I have had the incidence of training a lot of surgeons also. Most of us, when we become big, we generate skills, we generate money, but we forget about our own people. All what I learned is going to go waste into the dust if I do not transfer the skill and the wisdom to all my fellow colleagues. And we are doing that. And this IRCAD India is at Indore, right here in the city, which is training thousands and thousands of surgeons every year involved in the innovation. Now, we have hospitals all across the country, but that is not important. The important is how we reframe, how we look at a picture in a very different way. I'll tell you something that a lot of people say, our peers would say, or our seniors would say, this is the rule and that's how it happens. No, guys, there is no set rule on this earth. No set rule on this earth. This is a photograph of me completing a 70.3 Ironman. And you know why this photograph is special to me? Because I completed this Ironman race 6 months after I had a heart attack. Everybody said you cannot do it. That's the reframe of your life. There is no set rule. You can create history, you can rewrite history, and you can win this whole world by your own rules. Thank you very much.